What is an ICS?
Well, it stands for Integrated Care System, and I suppose in simple terms that means bringing together local authorities, all of the NHS organisations, and indeed the voluntary and community sector. So it's thinking about everybody who might impact on the health and well-being of our local people and trying to organise those efforts in a much more coordinated way so we support people to have long, happy and healthy lives.
So it's a whole new acronym to learn, but we've also heard a lot about an ICS strategy. So what does that mean? What's an ICS strategy?
I suppose the strategy is the plan amongst those group of people about what are the things we need to concentrate on. So what are the priorities, especially working together, we can do things quicker, we can do them more effectively to support people. It's also about how we work together. So we can make plans, but ultimately it's how we trust each other, how we support each other, how we notice the right things and share that information so that we really do try and concentrate support where it's needed most.
And what kind of things will the strategy include?
Well, the strategy will say something about what we think the current needs are for our local population. It will reflect lots of information and understanding that's already out there. Some of that is data, but a lot of it is also about people's opinions about these are the things that matter to me and these are the things I would like to see improved. So the strategy will build on that, and it will lay out then what the priorities might be going forward for us as a collective to work on. And of course, importantly, saying, well, how will we know if we're making a difference? So we'll say something about what the actions are, what we could see in terms of improvements that should follow, and making sure we keep a track of that, because if things start to go off course, then we want to be able to get in there and make sure the right things are being done.
So in terms of creating the strategy, who's involved in that? And perhaps more importantly, what will actually happen? What will we use the strategy for?
So I think I've talked a bit about the organisations that are already involved, so the statutory organisations like the NHS, like local authorities, but the aim is to reach much more into communities now. We know that if we're going to tackle inequalities, if we're going to build fairer societies, it's so important to get close to local communities, to understand what will work for different groups of people, and to make sure that we're getting the offer right. So in terms of the strategy itself, so far we've started with a number of bringing together a number of sources of information we already have, but we're keen to build on that. And I suppose the important thing is in developing the strategy, it's not a one-off conversation. This should be about a constant listening exercise, trying to make sure that we know our communities well, that we understand what will work. And indeed, not just the communities, but our staff, all the people working in those services, they know so much about what could be better and what changes would make our services even more effective for people, and hopefully, most importantly, support people earlier. So we see less people with real problems in their health and well-being. The earlier we can get there, the better it is for them, and ultimately we're able to move our resources around more effectively to help those people who need that support most.
Great, thank you, Matt. So I think the message is very much that the integrated care strategy is a really important document that's going to help us to set our priorities, to think about the big objectives that we've got as a system level, and to help all of us through the voluntary and community sector, through NHS organisations, through local authorities and other partners, to make sure that we're making the right decisions to improve the health and well-being and care for our local communities. So please do get involved in the shaping and crafting of our integrated care strategy.